Is live. All right. How's everybody doing? Oh, my glass up. How's everybody doing out there? Dr. Michael Breus, the sleep doctor here. Excited to have another YouTube live with everyone. I know people are kind of filing in, so please come on in. There's plenty of room on the internet for us to talk about sleep. It's going to be fun. I'm happy to have everyone here today. Any questions you have, just pop them in the chat. My team will be monitoring the chat for questions throughout the hour that we're going to be here. And wanted to tell you about a few different things that I've got going on, just in case you haven't seen. Published today, I did a video on how aging impacts sleep. Pro tip, it does, but I've got plenty of super duper healthy seniors who actually get great sleep, and there's some tips and tricks to think about there. On Thursday, I published how stress impacts your sleep and what you can do about it. Stress impacts so many different things. Sleep, it turns out to be one of the biggies. The good news is we definitely have some tools out there that we can utilize for stress and sleep. Last week, I did a piece on sleep paralysis, kind of talking more about the biology of what's going on and why it's not as scary as you might think. A lot of people, it's so funny to me that so many people ask questions about sleep paralysis, but it is a big thing and people want to know about it. So we did a quick deep dive on it so everybody could really learn as much as they wanted. Also, for folks out there, you might not have known this, but I did a really cool interview with Jim Quick. Jim Quick is a dear friend of mine, former patient, and he is a memory and learning expert. I know his name Quick. It really is his name. He didn't change his name for that. And we talked all about how does sleep affect memory? How does sleep affect focus? We talked quite a bit about AI. Good news is it's not going to take everyone's job. He talked about how AI might help us all learn how to remember things better, things of that nature. It was a great conversation. I highly recommend you checking it out. And then also I did a whole summary on cannabis and sleep. As you all know, I live in California. I'm pro cannabis, but I gave you some of the best advice on the different strains of cannabis to help you sleep. And it's probably not what you think it is. So with that, I thought I would go ahead and jump on in with a few questions that we had. We had a few questions backlog from the Ask the Sleep Doctor, and then I want you guys to be posting questions as well. So I've got a question from Max, and Max says, let's see, I'm finding ways to hack my chronotype. Probably not the best idea, probably to just go with the flow of your chronotype. And he said, one night I was sleeping and I had a feeling of about to fall off my bed, and the feeling came from my back. So my question is, what can I do? So this is called a hypnic jerk. So this is it's actually a well-known sleep anomaly, usually occurring based on sleep deprivation. So remember, sleep deprivation is either not sleeping enough time or getting poor quality sleep. So as my advice came from the beginning of the question, which was I probably wouldn't hack your chronotype, the more you sleep within your kind of chronotypical swim lane, the less likely this is to occur. You might need to get a little bit more sleep. Usually for folks out there who have this kind of reaction, once we actually engage them and have them have a little bit more sleep, it usually goes away. All right, let's see. Who have I got next? Next, I've got Andrew. And Andrew writes, how do I combat waking up at 2 to 3 a.m.? I don't eat. I watch screens before bed, not stressed, exercise, still wake up about 4 or 5 times nights in the middle of the night. Andrew, this is the number one question that I get asked. The good news is, number one, for everybody to know, I've got a video about this on YouTube called How to Fall Back to Sleep. But let me give you some of the highlights, if I can, of that video. Number one, this actually probably has more to do with biology than anything that you might think you're doing incorrectly. So first of all, your core body temperature will rise till about roughly 10:30 at night, and then it begins to fall. When it drops, that's a signal to your brain to release melatonin, okay, which is kind of that key that starts the engine for sleep. Everything here is copacetic. Then it keeps dropping. Well, unfortunately, you can't just keep dropping forever. Otherwise, you go hypothermic, you freeze, and you die. So we want it to start going back up. So around, guess what time, you make that turn, and all of a sudden now your core body temperature is starting to rise. Yep, you guessed it, between 1 and 3 in the morning. So believe it or not, every human on Earth probably wakes up between 1 and 3. The issue is most people don't even stay awake long enough to recognize that they're awake. Maybe they're awake for 3-5 seconds. The difference is you, my lucky friend, are one of those people who, when you do wake up, you actually stay up. And so there's a lot of different things that you can think about doing during this period of time. I want to be clear, though, biology has probably gotten you there. This is assuming that you don't have caffeine on board. Hopefully, you're sleeping within your kind of chronotypical swim lane, as I like to call it. If you don't know what your chronotype is, swing on over to www.chronoquiz or go to Sleep Doctor. Either one, you can check them out there. And you can take the quiz in like 3 minutes and figure that out for yourself. But, if it is the middle of the night, there's a few things that I would recommend. Number one, and this is going to sound a little strange, but don't pee. I don't mean don't actually go to the bathroom. What I mean is a lot of people, when they wake up, they say to themselves, well, I'm awake, I might as well go to the bathroom. It's really not the best idea, and here's why. In order to enter into a state of unconsciousness, you want a heart rate of about 60 or below. So when you go from a lying position to a seated position to a standing position and you walk across your bedroom, guess what? You just jacked your heart rate above 60. So then when you get back, you don't know it, but you're never going to get to sleep unless your heart rate goes below 60. And if you sit there and realize, hey, I'm not sleeping, it's never going to get below 60. So if you don't have to go, don't go. If you got to go, please go pee. Now, if you go to the bathroom, do me a favor, set some night lights along the way so you don't have to turn on any lights, because if you turn on the lights, you just told your brain it's morning because it can't tell the difference between your light in the bathroom and the sunlight, and it stops producing that melatonin that you want. So put some strategically placed night lights, go in, do what you need to do, come back out. Okay, now the question is, what do I do now? Now, the best thing is to not look at the clock. I'm going to be honest with you. Everybody looks at the clock. And then you instantly do the mental math and you say, oh, crap, it's 3 o'clock in the morning and I've got to get up at 6. Sleep, sleep, sleep. And you try to force yourself to sleep. Now, I'm going to be honest with you. In the history of time, no one in the history of time has ever been able to force themselves to sleep. That's not how sleep works. Forcing yourself to do anything engages something called your sympathetic nervous system. We want your parasympathetic nervous system to kick into gear, which is a relaxed state, not a forced state. So, number one, if you can force yourself to not look at the clock, that would be fantastic. But I'm not so foolish as to think that. Now, once you've gotten to this stage, you really want to think about, how do I lower my heart rate? What's the best way to do that? I would argue 4-7-8 breathing. So it's exactly what it sounds like. And I've actually got an article on the website about breathing techniques. Breathe in for a count of 4, and it's a slow, easy breath in. Hold for a count of 7. Breathe out for a count of 8. You want to do this for about 10 to 12 cycles. Now, I'm going to be honest with you. When I do this at night for myself, how I do it is I lay down and I have both of my hands in fists down by my side. And when I get through one cycle, then I stick out one finger, and then I stick out 2, and I stick out 3, because sometimes halfway through I get lost. I know that sounds ridiculous, but the truth of the matter is then I get upset and then it doesn't work anymore. So whatever your method is to keep yourself straight with it, that's what I do. Hold for 7, push out for 8, 10 cycles of it. At that point in time, your heart rate should be nice and low. And then the goal here is to just relax yourself into sleep. Now, you might be saying, okay, I get lowering my heart rate, Dr. Breus, but what does that mean? Relax myself into sleep. There's now data on something called non-sleep deep rest, which means lying in the dark, in the quiet, just relaxing. It turns out it's rejuvenative. It's not the same as sleep. I'd say give or take about an hour of that is worth maybe 20 minutes of sleep. So if for whatever reason you're able to lie there for an hour, you just got 20 minutes of sleep. If you lie there for 3 hours, it's equal to 1 hour of sleep. So I know this was a bit of a long-winded one, but this is a question that a lot of people have. So I wanted to kind of go into the depths on it. But this is really what people are looking for when you're trying to fall back to sleep. Also, at the end of it all is the idea of acceptance. And so what do I mean by that? Here's the good news. It's not like your head's going to pop off because you can't fall back to sleep. It's happened to you many times before. And so sometimes we just have to accept it and say, hey, our bodies may have a better control of this situation. I'm just going to relax, get that non-sleep deep something or another that sleep guy was talking about. And hey, we'll be in good shape. sometimes that actually is the best medicine, believe it or not. A lot of people want to know, should they, if they wake up in the middle of the night, at these take another sleeping tablet or take some type of medicine? It's really not advised to take anything in the middle of the night, primarily because most substances are built to last longer than the 3 or 4 hours that you've got left for sleep. And so you're groggy the next day, driving to work, probably not the best idea. All right. Next, we've got Raymond. And Raymond says, why do I feel so tired throughout the day, even though I get recommended amounts of sleep I need? So I'll tell you why, Raymond. It's interesting. So a lot of times when we think of sleep, we only think of it in minutes or hours. But the truth of the matter is we need to think about it in quality terms. So one of the things when somebody turns to me and they say, hey, Dr. Breus, I sleep 8 hours, 9 hours, and I still don't feel so great, it's usually a red flag to think about maybe doing a sleep test. Now, a sleep test, depending upon the type of sleep test, can give you some more information about the quality of the sleep that you're getting and if potentially you have a sleep disorder. So as an example, if you turned to me and said, hey, I got 8 hours of sleep, I don't feel so great, but hey, I'm not interested in going into the sleep lab and I don't want to go to the hospital. I don't want to deal with all that stuff. Well, the good news is since COVID, now most of this work can actually be done out of your home. So they now have what are called HSTs, so home sleep home sleep tests, HSTs, home sleep tests. And they send them to your through the mail to your door. You wear them on your wrist. You got something under your nose, and you wake up in the morning. All the data pops to your phone, and you're talking to a doctor on a teleconference. And before you know it, you've been diagnosed, and you figure out what's going on. So the good news is that there's more to it. And what I would suggest is if you're feeling like you're not getting good quality sleep, it's probably worth investigating. Let's see. Who have I got next? Is it Claudia? I think so. Claudia. Is the quality of sleep good with Ambien? That's an interesting question. So here's what we know about a medication like Ambien, also known as Zolpidem. When you read through the literature on this drug in particular, and I'm not speaking about all drugs now, I'm speaking about this drug in particular, it appears to not affect your sleep architecture, meaning that you should get roughly the same amounts of sleep that you would get without Ambien in terms of the percentages of each one of the sleep stages. Ambien should extend the amount of sleep that you get. Now, the truth of the matter is Ambien works really, really well to help put people to sleep. And oftentimes, once people are asleep, they stay asleep for an extended period of time. I've had many, many patients who have gotten great sleep on Ambien. It's worked quite well for them. And then I've got patients who say to me, I don't like the idea of being on a medication for the rest of my life, or they may have a doctor who says, I'm no longer comfortable prescribing this. As a general guideline, what I would tell you is I've had great luck with patients who have come to me on Ambien, taking them off of it with their doctor's permission and tapering schedules. So it works well and can be a great solution. But generally speaking, the quality of your sleep shouldn't really be affected. All right, who have we got next? It looks like Karen. Here we go. So Karen writes in and she says, I'm 67. I have great sleep hygiene. I exercise, eat well. I sleep well. I'm a lion. So that means she's taken her chrono quiz. Awesome. And she's an early bird. From fall until this time of year, when I wake up after only 3 hours of sleep, I'm up for hours, then sleep only a couple more. I try to get morning light, keep it dark before bed, no devices. Haven't found a way to make a 0.5 milligram melatonin work before bed. Any suggestions? I'm a wreck. Karen. All right, Karen. So first of all, let's see. So you do well from the fall. Okay, so from September until spring. And then, okay. And so I guess with the time change seems to have had a pretty big effect on you. If that is the case, that's interesting. And the 0.5 milligram of melatonin didn't work. No, well, number one, I would caution you, melatonin should be taken approximately 90 minutes before bed. So taking it just before bed is probably not going to show much in the way of effectiveness. I am glad to see that you had the right dosage. That is the correct dose, which is a 0.5 milligram. And a lot of people don't know this, but melatonin that's in like a gummy or a tablet form has to go basically down your throat, into your stomach, get digested, perforate, get up to the brain. Like, it takes a while. So that's going to be like a 90-minute journey before your brain kind of recognizes it. Now, there is a way to kind of fast track that, and that would be to have sublingual melatonin in drops that's available in stores. And you just put it under your tongue and let it sit there for about a minute or two. So count to 120, then swallow. That might help get it up and in a little bit quicker. As a lion, I would say one thing that you could try to do is maybe alter your bedtime by an hour later. Now, I know that's not generally what lions like to do, but I think that might make some sense because it will help maybe push you a little bit further down that path. And then hopefully with that added sleep deprivation and then the melatonin on board, you should be able to start to hopefully fall asleep a little bit better. We'll have to see what happens. Let us know. To be clear, that is not medical advice. I'm just telling you what to do with your melatonin. All right, next, what have we got? Amy. Amy reports, help with getting used to my CPAP. I've had it 2 months, some days, sometimes 4 or 5. Most days, I'm ripped it off after an hour. Okay, Amy. So this is actually one that we get quite often. So a CPAP machine can definitely be a bit on the uncomfortable side. Also, when you lay down, it can almost feel claustrophobic at first. So the very first thing that I tell most people to do is put the mask on, remove the hose, and after you finish your hygiene, read a book in bed with the mask on your face. Just get used to the idea of breathing through your nose, or if it's a full face mask, however you want, through the mask, but with it wide open. So that way it's pretty easy to breathe. There's no real resistance. If you have the whole hose on there, it's just harder to breathe and it's not worth it. So take the hose part off and just give yourself a good 20 to 30 minutes each night before you put it on, because number one, it makes it a whole lot less traumatic to have that whole situation occur. But number two, this is a protocol called systematic desensitization. And so the more often you do this, I mean, you can do it while you're walking around the house, like whatever, but the more used to it you get, the easier it's going to be. Now, how do I know this? Well, because I tried it myself. So it's interesting. I figured if I was going to have patients be on a CPAP, I better use one myself. It took me a fair 3 to 4 weeks to be able to sleep with it for an entire night. So don't give up hope. Do yourself a favor. Try the systematic desensitization. Also, talk with your provider. Maybe there's a different mask that might be easier for you to utilize, or they might have some tips and tricks. Maybe they can lower the pressure if there's too much pressure on there for you, or maybe use the ramp feature, things like that. All right. Next, I've got a question from Bob. Bob writes, I usually fall asleep quickly, then I awake 1 to 2 hours from bedtime to pee, and continue to awaken every 1 to 2 hours to use the bathroom, as it can take 5 to 15 minutes to get myself out of bed and to the bathroom because I'm tired, just like people set an alarm snooze. And 15 minutes to feel I've emptied my bladder, then 20 to 40 minutes to fall back asleep. This means I lose about an hour of sleep every time I awaken to use the bathroom. Had no sleep issues until 2014, when my inability to empty my bladder completely due to tight pelvic floor starting to cause this. Gotcha. Okay. So one of the first things I would start to look at is understanding what the limits are for you for fluid restriction. Right. So I would immediately talk with your doctor. Number one, let your doctor know, the doctor who has diagnosed the pelvic floor tightening, that this is what's going on. And they should be able to give you some type of a fluid schedule, meaning when you should stop drinking fluids, because one thing we want to do is just decrease the volume that's going in and out. They may also have some medications that can help you with this. For example, like a diuretic that can make you, get it all out of you pretty easily. So there are several options out there for something like this. That would be number one. Number two is what I don't know is if you've got sleep apnea or not. One of the things, you don't really tell me much about your sleep other than the urination problem, but one of the things we know is that people with prostate issues, which is what it sounds like this might be, on top of maybe pelvic floor issues, again, this is not my area of specialty, is that, it's could be something like sleep apnea that it could also be playing a role here. So when we see people who have these types of issues, there's oftentimes a high incidence rate of sleep apnea. And in that instance, it makes more sense to have a sleep study done so we can understand if you are having apneic events, because that if you are and that's treated, then you can probably sleep a little bit deeper. And at that point in time, it becomes much better and less bit trips to the bathroom. So I would say that that's probably what you should probably think about doing, is talking with them about a fluid restriction schedule, and then maybe talking about them if you have any of the signs or symptoms of sleep apnea. Let's see. Next, I've got Terry. And Terry writes, I have been on Trazadone and Ambien for about 30 years. They don't seem to work anymore. What do you know about the efficacy of Trazadone? Interesting question. So, Terry, while I don't know you or your case, it's an that would be an interesting combination of medications. Not unheard of, by the way, and oftentimes works well. I have seen people who started out on Ambien and then Trazadone was added to kind of help keep them asleep longer, or something that they could take for extended periods of time. And then the Ambien kind of goes away. Trazodone is one of those interesting medications because in the clinic, oftentimes we see it working at one dose for 15, 20 years. For some people, it doesn't do anything for them. At the end of it all, I don't know if it's, if the wheel isn't broke to fix it type of thing. I would say at the end of the day, if it's been working well, and you and your doctor are comfortable with it, I don't see any reason why you would question its efficacy. Now, if you tell me, hey, it's not really working anymore and I don't know what to do, then it's probably time to have a conversation with your doctor and let them know that this one either needs a dosage change or maybe a product change. All right. Who we got next? Jason. Jason reports, I've been taking 3 milligrams of isopaquone for the past 4 months with no side effects. I believe that's trade name is Lunesta or Sonata. Lunesta, I think. My sleep is much better with it than without. If I continue to take this each night forever, are there any long-term, I guess you're asking about consequences. Well, I don't know. To be fair, most sleeping meds were not meant for people to be taking them every night forever. That's really not how these medications were designed. That doesn't mean that's not what people end up doing, and that doesn't mean that that's not how doctors end up prescribing them. But we don't have tremendous data on 10 years, 20 years on these types of medications. Some of them we do, some of them we don't. So I think at the end of it all, I think these medications are useful for short-term use, but when you really look at the data, here's what I can tell you is cognitive behavioral therapy will take longer, but it will last a lifetime and you'll be able to learn how to put yourself to sleep. So I would suggest that in most cases, you probably want to use this isopaquone as maybe, as maybe a break to kind of establish your sleep with your doctor, and then talk with a cognitive behavioral therapist about how to then taper and learn how to sleep on your own. There we go. So let's see. Our next question is from Patrice, and she says, hi, Dr. Breus. I have what has been described as trauma-induced complex sleep apnea. Any suggestions on how to improve sleep and nervous system regulation? Is it possible to heal this? Trauma-induced complex sleep apnea. Okay. So complex sleep apnea for folks out there is both obstructive and central sleep apnea in combination. That's number one. Number two, trauma-induced would include either potential head trauma, throat trauma, lung trauma, things of that nature. So it could be neurological trauma that's causing this. There's a whole host of different things that could be going on. So this is a incredibly complicated case. Number one. Number two, here's what I can tell you is trauma is one of the more interesting areas because it is so unpredictable. And I've seen so many people where they're like, there's no way this person's going to get better. And, you talk to them a year later and the miracle has occurred. So I would say that number one, is it possible to heal this? I'm not a surgeon and I don't know exactly where or how the trauma occurred. So I can't really give you a real strategy there other than to say, I would talk with people who are specifically, familiar with your case, and look at some of their suggestions. Now, how do you improve sleep and nervous system regulation? It's a great question. I think number one, from my standpoint, it would be regularity of schedule would probably be one of the first things that I would want to try to improve upon. Again, I don't know exactly what your sleep schedule would be, but as a general guideline, regularity of wake up time is always something that helps people quite a bit. And I think that can be helpful as well. The use of your CPAP machine nightly is always a good idea. I'm guessing that if it's complex sleep apnea, you may have a special type of machine called an ASV, which also helps ventilate you as well. So that's going to be good. So I would say number one, wake up at the same time every day. Number two, use your CPAP machine nightly. And I think that would probably be quite helpful. And then based on your trauma, I would say whatever recommendations that your doctors have for, like if it's head trauma, then you're doing head trauma, recovery. If it's chest trauma, then you're doing, you might be doing cardiac trauma recovery. So depending upon the type of trauma, would move forward with that, and just keep using the CPAP, keep waking up at the same times if possible, and overall over the course of time as you heal, which is part of the sleep process, your sleep will continue to improve. So let's see. Next, I've got Danica. And Danica writes, I feel so tired throughout the day. Then at night, I can't manage to fall asleep or stay asleep. If I wake up because of the bathroom or noise, I cannot go back to sleep. Why is this? Danica, you sound like an extreme wolf to me. It sounds like you have a late night chronotype, and that is why you would prefer to sleep in the early morning hours and be up late at night. So if you want, go take my chrono quiz. I think you'd learn a lot. My guess is you're going to turn out to be something called a wolf, and then we'll give you all kinds of interesting recommendations. So thank you, Danica. Oh, is that a dog with you? Oh, that dog is cute. Okay, so next is Live Hard 6458. And so Live Hard asks, what is the best strategy to wean my dependency on Zolpidem? So Live Hard, that is not my department. To be fair, that would be me giving you medical advice, and that is something I cannot do. But what I can do is direct you back to your doctor. So what I would do is talk to your prescribing doctor, and they will be able to give you what's called a tapering schedule, where you will reduce the medication by a certain amount each certain time period. That makes it much easier for you to eventually get off of it. But it's called a taper schedule, and that's what you should ask your doctor for. Good question. Let's see. Next, I have Steve, and Steve writes, How can I tell if I'm getting enough deep and or REM sleep? I have an Apple Watch, and I'm constantly getting less than an hour of deep REM sleep. Steve, you have the same problem that everybody who tracks their sleep has, which is accuracy of the device. So number one, don't worry about it. To be honest with you, it's not. You can't look at the individual number. So what I tell everybody all the time is, because people walk up to me all the time and they're like, Dr. Breus, what does this mean on my phone? My Apple Watch says I get 14 minutes of deep sleep. It doesn't mean anything. What it means is that the device is consistently being potentially inaccurate. What you really want to look at is if it says you're only getting 14 minutes, I don't think I care. But if it says 14 one day and 300 the next and 200 the next, then I kind of want to know what's going on, right? So I'm looking for what I call the delta or the change in the data. That's where I think it gets more and more interesting. Now, as a general guideline, if you're looking for how do you get more deep sleep or more REM sleep, a couple things I can tell you. The biggest one, wake up at the same time every single day, including the weekends. That will allow your body to reset at the same time every day. And then you get a much more consistent sleep schedule and distribution of sleep stages. If you want to be even better at that, you want to wake up based on something called your chronotype. If you don't know what that is, go to sleepdoctor.com, take my quiz, won't cost you a dime. And you'll learn what your chronotype is, and then it will give you very specific advice. And then you'll start to see all of that potentially increase. Great question, Steve. Okay, Joni asks, what are the best treatments for adult sleepwalking? So great question, Joni. So first of all, we don't see a tremendous number of adult sleepwalkers. It's interesting. About 25% of children sleepwalk, believe it or not, and only about 2 to 3%, sometimes as high as 5%, depending upon the population, we see sleepwalking. Now, I will say alcohol-induced sleepwalking is a whole different story. We do see quite a few episodes of those occurring, and obviously you get rid of the alcohol and the sleepwalking goes away. Generally speaking, the frequency and the intensity of these events is directly related to how sleep deprived that individual is. So what I tell people all the time is if you've got somebody that's a sleepwalker and they're sleep deprived, they need to get more sleep. And that needs to be, they need to get higher quality sleep as well. And I think that's really kind of one of the key aspects to it, because just getting more sleep isn't going to help you out, but getting higher quality sleep lowers that level of sleep deprivation, and that should lower the sleepwalking incidence. Also, safety is going to be a major concern. So you're going to want to put a gate up at the top of the stairs and a gate at the bottom of the stairs. You know, you want to have a, you don't want to have a bolt lock on your inner door lock. You want to have a key lock and then remove the key so somebody doesn't unbolt the lock and walk straight out of the house, which does happen. I've seen many sleepwalking cases. Believe it or not, in some instances, medication can be used. The medication that has been used historically has been Klonopin, 0.5 milligram. And a lot of doctors find that just keeps you in one place and keeps you sleeping. To be fair, if it's somebody that's an adult that's a pretty frequent sleepwalker, even when they get good sleep, it's probably worth doing a sleep study on them. Number one, some sleepwalking incidences can be secondary to sleep apnea. Some sleepwalking instances can be due to different kind of neurology going on. All kinds of different things can cause something like that. By the way, it has a tendency to happen in the first part of the night. If you have somebody who's sleepwalking and it's 4 or 5 o'clock in the morning, that's could be something REM behavior disorder, which is something a bit more serious. All right, let's see. We've got Thomas, and let's see. Thomas writes, "Dear doctor, can you recommend some sleep sprays to use instead of the ones we used to be able to get from you since they don't seem to be available anymore, please?" Thomas, you're so kind. So unfortunately, yeah, we stopped using those now. I'll tell you what, I haven't found anything that I like as much as the ones that I had. But what I will tell you was one of the secret ingredients was magnolia bark. We used magnolia bark in it, and it really worked well because with valerian and a little bit of hops. And so if you can find something that's got magnolia bark, I think you're probably moving in the right direction. Next is Orit, and Orit writes, "Hi, I'm a night person who wants to be a daytime person. What's a good way to do that?" Orit, I've got some bad news to break for you, buddy. It's genetic. So it's not too easy to just kind of snap your fingers and turn yourself into a day person or a daytime person. What you would have to do is treat yourself as though you are constantly jet lagged, and you would have to take melatonin before bed, and you'd have to have bright lights when you woke up. And to be honest with you, it would be pretty miserable. But after about 30 to 60 days or so, I think you would absolutely be able to kind of force yourself there. But then again, you're doing this every single day. And so the health consequences of melatonin every day is it's probably not the best idea unless you're a shift worker and that's kind of what you're having to do. And then there's a whole different conversation to have. So that's not Edward. Edward asks, can antidepressants affect your sleep negatively? This is a very interesting and probably controversial question. So number one, some people would say yes, but other people would say that the good outweighs the bad. So if somebody is suicidal or really depressed and the antidepressants help prevent that, then if it affects their sleep negatively, but doesn't turn them into a zombie, I think a lot of the medical field feels like that's okay. I think it depends on the individual, and I think it depends upon the antidepressant and what it's doing to their sleep. To be fair, not all antidepressants act the same, even in the same person, for sure in the same person. So sometimes it's about trying to find something that works. But as a general guideline, SSRIs usually knock out REM sleep, sometimes almost completely. In some cases, clinics will use antidepressants to treat nightmares because it just knocks out REM sleep and that slows the nightmare progression down pretty quickly. So again, it sort of depends upon what you're looking at, but I would say, can they? Depending upon the antidepressant, depending upon the person, yes, but those cons might be outweighed. And let's see, we've got Joy, and Joy asks, what do you think about mouth guard use for mild apnea? Is it recommended always to use CPAP even if you have mild apnea? Joy, actually, they now make specialized mouth guards for sleep apnea. So you can actually replace your CPAP. And having mild apnea, I think, is all the more reason to use one of the what are called oral appliances. To be fair, CPAP is not fun, and it's really only great to use when it has a big effect. And when you've got mild apnea, I'm not convinced sometimes for some people that the juice is worth the squeeze. So, having an oral appliance, I think, makes a lot of sense. However, you do want to talk with the people who provided you with the CPAP because they're going to know about a dentist who can make this for you. And dentists are the ones you want to do this because if you don't have a dentist do it, you can have tooth movement. You can get transmandibular joint problems, so what's called TMJ. So you really want to have somebody who's highly qualified do it. But yeah, I wouldn't just say a mouth guard. I would say you want to look for an oral appliance. We have quite a few articles at Sleep Doctor about this. So go to the website and read up on it. Also, I think I've got some videos on oral appliances here as well. Okay. Ken Cho asks me, do you recommend a Tempur-Pedic mattress with an adjustable base to sleep well? So I will tell you this. I love adjustable bases. I have really enjoyed, we had one for a long time and I really enjoyed it. It was great for my back, things like that. I think that it's hard to make a blanket recommendation about one brand of mattress. Number one, they have a lot of models, but number two, there's a lot of them out there. So if you're looking for a foam-based mattress, actually, we actually test a lot of mattresses. We've tested almost 150 of them. So it's probably a worthwhile idea. Go over to Sleep Doctor and type in best foam mattress. We've got a listing. I'm sure there's a Tempur in there, and we've got ratings and things like that. We brought it into the lab, did all kinds of fun testing on it. So it's probably worth your while to check out. If foam is your thing, then that's probably where you want to go. Again, I love adjustable bases. I think they make a lot of sense for people. I think people really enjoy them. So as a general guide, I like them quite a bit. All right, let's see. Joni asks, she says, what about strategies for managing narcolepsy, trouble sleeping at night and staying awake during the day? So, Joni, when you look at the current treatment modalities for narcolepsy, there are a few. The newest, latest, greatest, I would argue, is probably something called Xyrem, XYREM. So Xyrem is it's actually a very interesting concept. It's a medication that was developed from sodium oxybate, which was the date rape drug. And so what it does is it slams you into deep sleep, and it keeps you there for about half the night. You wake up half the night and you take a second dose. And then it puts you back to sleep. And it's remarkable what we've learned about narcolepsy, in that narcolepsy, we used to think narcolepsy was like your sleep switch would pop on during the day and you just, face in the soup type of thing. But what we've discovered probably in the last 20 or so years, and when I say we, I don't mean me, I mean the amazing researchers out there in sleep world, they discovered that it's actually people getting really bad sleep at night. And so sodium oxybate literally puts you into deep sleep. It's one of the only drugs that does. So I think there's some real utility there. So I would say that if you're having trouble sleeping at night and staying awake during the day, and you have narcolepsy, and it's real narcolepsy, you probably want to talk with your doctor about Xyrem and understanding more about that. All right, let's see who we've got next. So Laura wrote in, I had a sleep test and have sleep apnea, but can't tolerate my mask from my machine. Well, you are 50% of the people out there would agree with you. Don't worry. Depending upon the severity of your sleep apnea, one thing you can do is get an oral appliance. We were just talking about them a moment ago. These are Mouthguards, where there's an upper and a lower, and the lower pulls your jaw forward, which opens up your posterior airway space, and that kind of allows you to be able to breathe a whole lot better. So that's one thing that can be done. But to be fair, one thing I always tell people is you really want to give the CPAP a fair try. Primarily because it works 99% of the time, which is pretty remarkable when you think about a treatment modality that works so well. So, a lot of people, I tell them, look, it takes 3 to 5 to 7 weeks sometimes to get used to it. But once you do, I've got some patients now who they say they'll shoot me if I take their CPAP machine. I know that's hard to believe, but that is the truth. Oral appliances are good. And of course, there are surgical interventions. So if you want to have surgery and just fix the problem, that's not the worst idea that I've heard either. There is a couple of different surgeries out there. One is called Inspire. You've probably seen the commercials for it on television. This is that you've got a little remote control and you put something on your chest, and there's a little silver dollar size piece that's underneath your clavicle, and it runs a couple of wires up your neck. You can't see them, and it plugs back basically into the vagus nerve in the back of your tongue. So every time your tongue starts to fall back, it kind of gives it a shock. You can't feel it, and it pushes your tongue forward. That's an option as well. Those have been highly successful, especially for the mild cases of sleep apnea. So you've got some ideas there, but on the site, we've got a lot of information about alternatives to CPAP machines, surgical interventions, and things like that. So I would, take a wander through there, and I've actually done some of that stuff on these videos as well. All right, let's see. Darcy, she asked, how can you find a doctor that will do a home sleep test? Lucky you, Darcy. If you head on over to sleepdoctor.com, you can order the test yourself. So the test isn't particularly expensive. It's like, I don't think it's less than $200. And you can actually get the home sleep test done. It is a 100% real home sleep test. Or you can go to the Sleep Centers with an S.org. So www.sleepcenterswithan.s.org. And at the top, they have a little zip code finder. And if you punch your zip code in there, it'll tell you who's got a sleep center nearby. Then you call the sleep center, and they will probably have some type of a program where they have home sleep tests. So that's another option. Let's see. All right. Eve writes, what is the best type of pillow for someone who tosses and turns at night? Love your videos. Thanks, Eve. So here's the thing. When you tell me that you're tossing and turning, that makes me think that you might be a side sleeper. And so very first thing I tell people is when you're picking a side sleeper pillow, you really want something that's going to kind of make up for, well, the microphone's in the way. Hold on. Make up for the space between your ear and your outside shoulder. So you're going to want to have a pretty thick pillow when it comes to side sleeping. But if you go from side to back, that's going to be a problem because then it's going to be thick and then it's going to push your head forward. So you're going to have to kind of figure that one out for yourself. I personally like the ones that have kind of a curve cutout shape because then I can get support all the way down to the base of my neck. You've probably seen me like lifting my hair just because my back is like giving me fits because of I have to have a side sleeper pillow and the whole thing. So don't forget, keep the questions coming. I'm always happy, and I'll be hanging out for another 15 or so minutes. So happy to answer all of the questions that you might have. Live Hard is back, and Live Hard has asked a question again. How effective are online CBT-I apps like Sleep Reset? This is a great question. So actually quite good. I know the people who created Sleep Reset, and it's from Dr. Grandner, Dr. Michael Grandner, and that thing works, and it works well. I've been impressed with the data on it. He and I have had a couple of discussions about it. So if you're willing to do it and follow the guidelines, I would say that one in particular, I happen to know works well. There are several on the market. There's Sleepio, there's Shut Eye. And all of them, I think, actually have been clinically tested. So the good news is that they all work. At the end of the day, you just really have to follow it. You really have to like pay attention and make sure that you are kind of following all the recommended guidelines. The closer you follow the guidelines, I would argue, the more positive outcomes you're probably going to have. But the good news would be that you would never have to take a pill again to sleep, which would be good. But if you're going to try that, do not pull yourself off of medication cold turkey, because then none of that system will work. Once again, you need to talk with your doctor, get a taper schedule, and slowly get yourself off of it. Okay, Rob is back and asks, what is your advice for getting past hypnic jerks when they're disrupting your ability to fall asleep? The big thing is to get more sleep. Now, that seems kind of strange to say that, but what I would say is increase the regularity of your sleeping schedule. So what I would say is the best thing for you to do at that point is maybe learn what your chronotype is. And then if you do, head over to Sleep Doctor, take the quiz, and then really pay attention to seeing if you can, keep within that schedule 7 nights a week. 7 mornings a week. Really, waking up at the same time, going to bed at the same time. That really has shown quite a bit of movement forward in terms of lowering the frequency and the intensity of hypnic jerks. Now, I believe there's actually a medication that can be used. I want to say imipramine. It's one of the tricyclic antidepressants, but I'm not sure. Not sure, because usually we just try to, increase their sleep quality, and most of the time it goes away. To be fair, it doesn't come up all that often, but I do hear about it from people from time to time. Let's see. Do I have any more? Oh, yep. Here we go. Richard. So Richard says, can you briefly talk about sleep hyperhidrosis, both causes and cures? So sleep hyperhidrosis is the night sweats, right? And so this is something that's believe it or not as uncommon as we might think. There is a medication, believe it or not, for this. I'm also going to be fair in telling you that, remember, I'm not a medical doctor, and so this would absolutely fall kind of out of my realm of specialty, other than to let you know that it's probably something that it could be thyroid induced, it could be circulation issues, but it's definitely something that you want to talk with your doctor about. Again, there is a medication I know that has been known to help with it. Changing the temperature in the bedroom does not seem to help one way or another, at least in the few people that I've seen who've had this. But as a general recommendation, I would say that it's probably worth talking with your doctor. Rudy comes in and says, I am a bear chronotype. If I'm working 8 a.m. to 5:30 p.m., what is the best time to study? Early morning or evening? I love your videos and all your information. Thank you. Thanks, Rudy. So bears in particular, once you get past like 3:30, 4 o'clock, it's not a good time for retaining information. So what I would tell you to do is, once you kind of get past your 8 a.m., a little bit of morning fog, depending upon if you got up on time or not, I would say better to probably study then, and then be able to kind of goof off a little bit later on, because it's just going to be harder for you to focus the later in the day it gets. Let's see. Terry asks an interesting question. She says, can long-term use of sleep medications cause dementia? So it's an interesting question. And the answers are even more interesting. So believe it or not, there's an over-the-counter medication that has been shown in at least one study, if not more, to have some very high links to dementia, and it's called Benadryl. Diphenhydramine. There's studies out there. I can show them to you. I've written about it before, but those are the ones I worry about. Long-term use of benzodiazepines, which are actually prescribed medications, yeah, we can see cognitive decline there. Absolutely. That would not be something that I would think would be uncommon. Does it cause dementia? I don't think we have any data that would suggest causality, but I think we do see pretty significant cognitive decline as you get people older and they've been taking benzos forever. I think that can definitely have some effect for sure. Long-term use of anything, I think, is probably not the best idea. These medications, once again, were not built for use forever and ever and ever and ever. And a lot of people have been on them, for quite a long time. So I think that's something to definitely kind of keep in mind, for sure. Next, I've got Eve, and Eve writes, is it true that everyone needs 7 hours of sleep? This is an ongoing debate in our home. So here's what I can tell you. Everybody needs a different amount of sleep. So when there was a time in my life where I would fall asleep at midnight and I'd get up at 6:15, no alarm, perfectly fine all day long. Later in life, I might go to bed at 11 and wake up at 7. So I think a lot of it depends upon your gender. I think it depends upon your age. I think it depends upon how stressed you are. It can depend upon how good a diet that you have, how much exercise you've done. But needs is kind of the interesting word here. So I would say from a needs standpoint, yeah, 7 hours of sleep is probably a good need. I might go as low as 6.5, but remember, if you wake up after 6 hours of sleep and you're bright-eyed and bushy-tailed and you feel pretty good, maybe 6 is your number. So Fire Lackey says, Dolphin here. What can I do to avoid the midday slump that makes me want to nap? Thanks. So a couple of different things, my dear friend Dolphin. One thing I always tell people to do is to go outside. If you know the midday is going to hit you and you're in an environment where you can go outside and get some fresh air, specifically some sunlight. Because what's going to happen is you're going to get a slight core body temperature rise and then fall, and that's going to trigger some melatonin. So you don't want that to happen. So probably best to just get a little vitamin D, get some sunshine. That'll definitely be helpful. The other thing that you can do is just do a little bit of stretching. In my fourth book, Energize, we had several different things that you can do. For me, I like to do either the bounce or the shake in the midday. That seems to help me kind of get back to it. You'd kind of be surprised. Or skipping. I know that sounds ridiculous, but it actually gives you a lot of energy. So if you check out my fourth book, guys, and you look at, we actually have a dolphin specific time to do these different movements during the day, and it's super helpful for maintaining energy throughout the day. So check it out. Let's see. Cherry. No, let's see. Let's see. Oh, Fire Lackey is back. I've done a home sleep study. Nothing stood out except that I have anxiety and I'm a light sleeper. I use earplugs, but are there any other solutions? I'm a dolphin getting 4 hours of sleep. So I guess at that point, done the home sleep study, nothing stood out except that you have anxiety and you're a light sleeper. So then I guess at that point, yeah, I guess at that point you have to look at, is there anything in the environment that is having an effect on you? Light, noise, temperature, things like that. We'd probably have to sit down and really kind of have a good um, really have a good discussion, because there's a lot that could be there, and I think that really is going to be important. So if you've tried a bunch of those things, maybe sit down with your sleep doctor and look at potentially any environmental cues. Allergies would certainly be something that could be potentially going on. And then what would be some different ways to reduce anxiety, whether that's medication or meditation or herbal treatments that could actually be quite helpful in that situation as well. Okay, my last question is coming from Wia, and she writes: is there a clinic that can help you learn ways to help you get to sleep, helping with learning good sleep hygiene? Huh, don't I wish? So unfortunately, sleep hygiene is not hard to find. Go on Google, type in sleep hygiene. It'll tell you all that good stuff. But at the end of the day, nobody's sleep magically gets better with just sleep hygiene. What I would say is you probably want to speak with an insomnia specialist or a sleep specialist. And so, any clinic that is certified by the American Academy of Sleep Medicine will have somebody kind of like me associated with them that's a PhD or somebody who's a specialist like that. And then they should be able to refer you to them. So I would go to sleepcenters with an s.org, put in your zip code, and find an accredited center near you. So that is it. I am Dr. Michael Breus, and I am actually going to be signing off now. I do want to ask everyone to, if you can, send me some questions whenever you can. We'll get them up and going. Also, let people know so we can answer their questions live. And if you haven't had a chance to stroll around Sleep Doctor, please do check out my chrono quiz. I think you'll get a lot out of that. Everybody that takes the quiz really does seem to enjoy it and learn quite a bit about themselves from it. From as far as the videos are concerned, don't forget I am having a book club, and so it's going to be fun. Jim Quick was our first one. I did the second one with my thriller. So if you're out there looking for a good sleep thriller, please go buy The Sleeper. That was my fiction book. And who have we got next? I think we've got, The Joy of Well-Being by Jacob and Colin Wachab, the founders of Mind Body Green. I'm going to be interviewing them. So it's going to be great. We're really spreading out and learning more from different folks and getting some great perspectives here. So I'm excited to let everyone know that we're here to stay. We're going to be back doing another live again, probably again at the end of next month. So look for that in your emails, and please check out the videos on YouTube. Thanks again, Dr. Michael Breus, the Sleep Doctor, wishing everyone sweet dreams.